treatment for breast cancer patients. Advanced nurse practitioner Anne McLaughlin from the Royal Marsden Hospital spoke at the event, with surgeon from the Leicester Royal Infirmary Graham Offer leading the conference.
I'm going to discuss the options for reconstruction for ladies that have had breast cancer. So after breast cancer, sometimes they have a mastectomy, so that's removal of the breast. So today I'm going to discuss what's possible to reconstruct these ladies.
When someone's gone through the emotional and physical turmoil of beating cancer, surviving it, when does reconstructive surgery come into it?
Well, after the initial shock, patients obviously have a long way to go with treatment, and they don't really have a choice. Whereas reconstruction empowers the lady to sort of take control, really, and in some ways rebuild what's missing. So it's difficult to rebuild psychologically, but physically, at least if they look more normal, then it gives them a lot.
I suppose one could argue that the last thing a cancer survivor wants to do is go under the knife again. So what would you say to that?
Yeah, I think that's very true. But obviously, women are left in a particular situation where they sometimes feel less feminine. They feel that they've lost control of their own body, and this gives them something back. Now, there are many ways of doing breast reconstruction. There are ways that would suit ladies with small breasts, ladies with larger breasts, different body shapes. Some are small operations, some are larger operations. And I think the key is to come along and discuss it with a surgeon so they can be informed and then make their own decision, because this is something that they can decide about. Whereas if a lady's diagnosed with cancer, they don't really have a choice. They have to have whatever treatment is there to try and cure them. But they do have a choice. So they sometimes come along and discuss it with me and decide they don't want reconstruction, but often they do go ahead with something.
I'm going to be talking about how cancer patients are followed up once they finish the main part of their treatment. So my talk really is about meeting the needs of cancer survivors.
So what are you hoping people will take from this conference today?
I hope that they'll just learn that the vast majority of treatments are very effective for breast cancer nowadays, that the long-term outlook is very good, that it's recognised that some patients can experience some ongoing problems, but there is ongoing help and support available.
So very much a positive message today.
Absolutely, yes. Yeah, very positive.
Breast cancer is the most common cancer in women, with early detection key in receiving treatment as soon as possible. The local support group offers support, information and practical advice to those affected by it, with a helpline open from 9 to 5 on weekdays and between 10 and 2 on Saturdays.